Chapter 7. Treatment of Schizophrenia and Psychosis. We'll skip over the key terms. We'll go through them throughout the chapter. Schizophrenia is a chronic and major psychosis that is characterized by delusions of thought, visual or auditory hallucinations, or both, and speech disturbances. Patients diagnosed with schizophrenia commonly can see visions or hear voices that cannot be seen or heard by others. Paranoid schizophrenia is characterized by delusions of persecution. It's particularly challenging because the patient can believe that the healthcare team is prescribing medications and therapies intended to cause harm. People diagnosed with schizophrenia often exhibit negative symptoms, positive symptoms, and cognitive symptoms. When they exhibit negative symptoms, visible signs of emotion and facial expressions, or interact socially with others, speech is monotonous. Positive symptoms may appear as bizarre behavior. People with schizophrenia may have delusions. Delusions are irrational thoughts or false beliefs that dominate a person's behavior. The person's viewpoint is unlikely to change, even when evidence is provided that the beliefs are not valid. People with schizophrenia may also have visual or auditory hallucinations. They respond to visions and voices that they can only see. They may talk to themselves, or when speaking to others, they may fail to complete sentences. Their thoughts are maybe finished in their mind. They're usually disorganized, the thoughts. It can interfere with the performance of daily life, and memory loss can impede the person's ability to function at a job. Schizophrenia also produces physical symptoms. The person may be clumsy and appear catatonic or make repetitive movements. People exhibit symptoms of catatonia, are unresponsive and immobile. Phenothiazines, butorphanones, and thiazanthines are categorized as first-generation antipsychotics. They are classified as low, medium, high, and high potency. The prototype for low potency antipsychotics is chlorpromazine. Medium potency is fluphenazine, and high potency is haloperidol. All other types of antipsychotics are categorized as atypical. Examples of atypical are risperidone, clozapine, and aripiprazole. Phenothiazines are also prescribed for the treatment of nausea and vomiting. First generation antipsychotics block dopamine at postsynaptic receptor sites in the brain. They have a strong alpha adrenergic blocking action that accounts for the hypotension produced by first generation antipsychotics. First generation antipsychotics are well absorbed orally, rectally, and parenterally. They readily cross the blood-brain barrier because of their lipid solubility. Alpha adrenergic blockade can cause postural hypotension, a drop in blood pressure caused by a change in posture. Extrapyramidal effects and tardive dyskinesia are associated with dopaminergic blockade and occur more frequently in elderly patients. Extrapyramidal symptoms are exhibited as excessive muscle movement. Tardive dyskinesia causes inappropriate postures of the neck, trunk, and limbs, and is accompanied by involuntary thrusting of the tongue and lip smacking. Phenothiazines are listed in this chart. Fluphenazine has quite a bit of different dosage forms and strengths. Haloperidol is the only listed butyphenone. This medication is given very frequently in the hospital, probably, and maybe mental health facility quite a bit. There's quite a few different options. And I know when I worked in the ER myself, there was a psych unit inside of the ER that I worked at. And usually, if the patient was being combative or having these crazy delusions and doing things that are unsafe for themselves or trying to leave, we could usually tell after the Haldol has kicked in because we wouldn't hear a peep from them for quite some time. The Theoxanthines, only the first one is available in the US, Navane. The other one is only available in Canada. Atypical antipsychotics that are used in the treatment and management of schizophrenia are aripiprazole, acenapine, brexpiprazole, cariprazine, clozapine, iloperidone, olanzapine, risperidone, quite a few. In addition, these medications can also treat bipolar disorder. And then the ones that are treated exclusively, that are used for treatment in bipolar, are olanzapine, which is Zyprexa, risperidone, which is Risperdal, Zyprasidone, which I believe is Geodon, and quidapine, which is Seroquel. Atypical antipsychotics act by several mechanisms of action. They act to stabilize the dopamine system. Some are partial agonists of dopamine, and others produce mixed effects on dopamine and serotonin. So here they are listed again. Abilify has a couple different dosage forms. Same with clozapine. And loxapine. Olanzapine, Zyprexa has quite a few different ones. Same with Invega. Risperdal has quite a few different dosage forms. And then we have Ziprasidone, which I mentioned earlier, is Geodon. And we have either an injection powder for reconstitution or capsules. Patients, prescribers, and pharmacists must be enrolled in a registry to actually dispense clozapine. Adverse side effects of atypical antipsychotics are dizziness, drowsiness, hypotension, headache, confusion, nausea, weight gain, increased urination or urinary retention, thirst, dry mouth, and sexual dysfunction. Aripiprazole may cause insomnia. Newer atypical antipsychotics such as Zyprasidone and olanzapine have less risk for these symptoms, but they are associated with hyperglycemia and the onset of diabetes. Neuroleptic malignant syndrome is a life-threatening side effect of neuroleptic administration. It produces symptoms of muscle rigidity, increased body temperature, fluctuating consciousness, and renal failure. Clozapine use is restricted because it can produce a fatal drop in white blood cells. Patients on clozapine therapy are required to have white blood cell levels monitored weekly while taking the medication. Antipsychotic agent should be used cautiously in patients with seizure disorders. Low potency agents and clozapine are most likely to induce seizures. Aripiprazole and acenapine labeling have a box warning. Elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. Mortality most commonly occurs due to sudden heart failure, sudden death, or infection. And aripiprazole and acenapine may produce suicidal thoughts. So we have our summary of drugs used in the treatment of psychosis, which we've already went over, but again, we have the warning labels on this table for each drug. May cause drowsiness, may impair ability to drive, avoid alcohol, maintain adequate hydration, avoid prolonged or exposure to sunlight, do not discontinue without medical supervision, dilute oral concentrate before administration, and that is for chlorpromazine and flufenazine. The medication thyroxine can cause your urine to turn a pinkish, reddish brown color. A lot of these medications cause dry mouth. Chewing gum or sucking sugarless candy can improve symptoms. But if you're taking long-term antidepressants, anxiety medications, or these medications for psychosis, dry mouth is a huge side effect. So more than likely, the pharmacist would recommend that instead of sucking on a candy or gum, that you maybe use biotin or biotin lozenges that work just as good, and they're going to help actually try to improve those dry mouth symptoms rather than just sucking on candy, hoping to produce saliva in your mouth. Haloperidol has pretty much all of those same warnings, along with Navane. For the atypical antipsychotics, they kind of have it listed nicely on which ones you should do which with. So may cause dizziness or drowsiness, so it lists all of those. May impair ability to drive, list those. Avoid alcohol, but I am going to say you should avoid alcohol with all of these medications. You should maintain adequate hydration for if you're taking these medications. All of these listed here, you should not discontinue without medical supervision. Then it just talks about some of the oral solutions and concentrates, what you can mix them in. And of course, we do not want to swallow, crush, or chew any extended release tablet.